Why osteoarthritis? Pinched nerves and repetitive strain contribute to hand weakness and grip problems. Struggling to open a jar or feeling your handshake go soft might seem like a small annoyance. Hand weakness can be an early signal of nerve damage, joint disease, or repetitive injury, and catching the cause early can prevent permanent loss of function. It's around age 60 when we commonly see symptoms of hand strength loss and loss of dexterity, said Kia Washington, MD, Associate Professor of Surgery at the University of Colorado School of Medicine, per AARP. Several conditions account for most cases doctors see.
Still spending forever chopping vegetables? The Full-Star Pro vegetable chopper dices onions, potatoes, and more into its container in seconds, helping make meal prep faster and tidier. Want to check today's Amazon deal? Scan the QR code now or visit grabdeal.us/2 before it's gone.
Some involve pinched or damaged nerves. Others come from wear on the joints, tendons, or discs in the spine. Peripheral neuropathy is nerve damage outside the brain and spinal cord. It can lead to a range of symptoms, like numbness, pain, and movement issues, according to Cleveland Clinic. Symptoms include tingling, muscle weakness, balance issues, and cramps. Early diagnosis matters because some types can be stopped or reversed. Carpal tunnel syndrome is the most common nerve entrapment in the upper limb, caused by compression of the median nerve at the wrist. Classic symptoms include pain and pins and needles in the thumb, index, and middle fingers, per the American Academy of Family Physicians. Providers often order electrodiagnostic tests on the nerves to confirm the diagnosis. Johns Hopkins Medicine says osteoarthritis affects more than 32.5 million U.S. adults, according to the Centers for Disease Control and Prevention. Once seen as simple wear and tear, it is now understood as a disease of the whole joint, including bone, cartilage, and the tissues lining it. It commonly targets the hands and can steadily erode grip strength as cartilage breaks down. Symptoms typically appear after age 50, though prior joint injuries can accelerate the timeline. A pinched nerve happens when bone, cartilage, muscle, or tendon presses on a nerve, causing pain, tingling, numbness, or weakness. In the wrist, this can trigger carpal tunnel symptoms in the hand and fingers, Mayo Clinic notes. Repetitive strain injury develops from doing the same motion over and over. It usually affects the thumbs, wrists, elbows, arms, shoulders, and knees, according to Cleveland Clinic. It can lead to tendinitis, trigger finger, tennis elbow, and other conditions that reduce hand function. A herniated disc in the neck or upper spine can send pain, numbness, or weakness down the arm. Most people recover without surgery, but you should call a healthcare professional if pain in the neck or back spreads into an arm, Mayo Clinic advises. A ganglion cyst is a fluid-filled lump near a joint or tendon, most often on the back of the wrist. The cysts contain clear, gel-like liquid and are non-cancerous, per the American Society for Surgery of the Hand. They can swell, shrink, or disappear on their own. If they persist or return, surgery is generally successful. Cubital tunnel syndrome occurs when the ulnar nerve becomes inflamed at the inside of the elbow. It causes pain that feels a lot like the pain you feel when you hit the funny bone in your elbow, Johns Hopkins Medicine explains. Frequent bending, leaning on the elbow, arthritis, or old fractures can bring it on. Tennis elbow, or lateral epicondylitis, comes from overuse of forearm muscles and tendons. Despite the name, most people who develop it do not play tennis. Plumbers, painters, carpenters, and butchers are commonly affected, according to Mayo Clinic. Rest, pain medicine, and physical therapy usually help. If home care has not resolved your symptoms after 7 to 10 days, it may be time to see an orthopedic doctor, University of Utah Health says. Book an appointment if pain persists at rest, returns as soon as you resume typing or carrying groceries, or if you notice warmth, redness, tenderness, or a fever above 100 degrees Fahrenheit. Losing your grip is not something to wait out.